Hi, my name is Brooke Hilton. I am a BSW student at the University of North Carolina at Charlotte. I'm in my junior year. Today I'm completing the Module 3 Voices discussion, and I will be talking about racial identity and the development of it. So I'm going to start off by explaining how racial identities can intersect with other aspects of identity, such as class, gender, or immigration status. Typically, that happens through intersectionality. Intersectionality is a framework that helps us understand how different systems of oppression and privilege can affect a person's daily life and how it affects their experiences. So race and class can intersect through racial inequality, class, stereotypes, things like that. For when we're talking about racial inequality, we see people of color who often experience maybe some disproportionate levels of poverty or lack of pay. This is kind of due to like historical and systemic racism. And then you have the class aspect where a working class, maybe Black or Hispanic or Latino person could face more obstacles or less pay or less benefits, things like that, compared to a white person or a person of non-color, even if they have like similar qualifications, things like that. That would be an example of how class could affect race. And then you also have stereotypes. So racial and class stereotypes can come together. It can portray poor people as people of color, or they're just lazy or criminal, and that can influence policy, media narratives, things like that. And then you want to talk about race and gender, how those two can come together. So for race and gender, people of color can experience like double discrimination. So for example, a woman of color can face both racism and sexism, which can create challenges not experienced by a white woman or men of color because they're white, not experiencing the discrimination, or they're a man, not experiencing the sexism. A good example of this would be that a Black female could experience some workplace discrimination differently than a white woman, just based on race. There's also stereotypes and violence. So gendered racial stereotypes. So a lot of people, not people, but some would say like the angry Black woman or the exotic Asian woman. This can shape how women of color are treated socially. So what we say can affect social systems and systemic racism as a whole. This can also affect people personally, professionally, and by institutions. There's also health disparities. So women of color can also often receive less health care or poor health care. They can also suffer higher maternal mortality rates and are less likely to have like their pain taken seriously because of the narrative that's in place on them. There's also race and immigration status. So there's legal vulnerability. Immigrants of color, especially when they're undocumented, often face racial profiling and exploitation in the workplace. They also have limited access to resources. There's cultural marginalization, where immigrants may be racialized differently once in a new country. So like South Asians in the U.S. being perceived as terrorists post 9/11, regardless of their immigration status or religion or anything like that. There's also the language barriers that come along with that. And these can show racial discrimination as well, affecting education and then navigating conversations about race and racial identity. It's very important for ethics and to be cultural competent. Race can deeply shape our lived experience. Social workers have to be intentional, self-aware, and skilled, and be engaging in these dialogues with clients, colleagues, and institutions. So it's very important. So with clients, you would want to create kind of a safe and respectful environment. You want to build trust with the clients, demonstrating humility and openness, and you don't want to demonstrate any of these racial issues that we talked about previously. You want to also let your client kind of self define their racial identity. You don't want to make any assumptions. You don't want to do anything like that, because you want to hear what they have to say and keep an open mind for them. You also want to be curious, not really defensive. You need to ask open-ended questions, respectful questions, make the client feel comfortable. If a client were to bring up like a race-related like experience, you would want to say something like, tell me how that affected you. Tell me how that made you feel, things like that. You don't want to ever rationalize racial trauma or minimize that. You also want to acknowledge racial trauma and systemic injustice. You need to recognize how racism affects mental health, whether it was past racism or present racism. You also need to take into account housing, employment, and family systems when it comes to this. You need to validate their experience of racism and integrate how this understanding can turn into treatment plans, assessment, leading them to correct resources, things like that. And then here comes the intersectionality part. You also need to make sure that the racial identity is intersecting with the class, gender, religion, things like that, and tailor their services according to this. And when it comes to clients, you need to validate them. You need to show them how strong they are, show them that they're resilient. You never want to frame a client in a bad way. So when they're telling you something, you always want to be like, well, that was really resilient, or that was really brave of you. Then you also have with your colleagues. So as a social worker, you want to engage in ongoing anti-racism work. So reflect on your own biases and your own privileges, participates in training, education, classes, conversations, and groups that kind of are affiliated with racial justice. Also, a big thing is challenging racism in the workplace. So speak up against things that you see that are not for racial justice. Speak up for things that, like speak up for a colleague of color in leadership and making decisions, things like that. You need to practice cultural humility and things like that. So you need to understand that you can never be fully competent in someone else's culture. Stay curious, ask questions, things like that. And then you also need to use supervision to explore how race shows up in cases, team dynamics, and your own reactions. Then you also have institutions and systems. So advocating for racial equity, equality, justice, all the things, not only with a client and not only with your colleagues, but with institutions and systems as well. So you want to push for inclusive hiring practices, equal resource distribution, and kind of redirect that a little bit. You also want to explore how policies could unintentionally uphold white supremacy or marginalize communities of color. Thank you.